Why are benign versus malignant tumors crucial for distal pancreatectomy? Imagine you are about to undergo a surgery to remove part of your pancreas. The reason for this surgery often depends on whether the tumor is benign or malignant. This distinction is very important because it influences how the surgery is planned, what kind of post-surgery care is needed, and what the long-term outlook might be. Benign tumors are non-cancerous growths. They do not spread to other parts of the body and tend to stay localized. These tumors can sometimes cause symptoms if they grow large enough or press on nearby organs. Common benign tumors in the pancreas include serous cystadenomas and certain neuroendocrine tumors. When these are found, the goal of surgery is to remove just the tumor while conserving as much healthy pancreatic tissue as possible. Surgeons often prefer minimally invasive techniques, like laparoscopic surgery, because they cause less pain, lead to shorter hospital stays, and help patients recover faster. On the other hand, malignant tumors are cancerous. They have the potential to invade nearby tissues and spread to other parts of the body. Pancreatic ductal adenocarcinoma is a common malignant tumor in the pancreas. Treating these tumors requires a more aggressive surgical approach. Surgeons usually remove the tumor along with surrounding tissue, which might include nearby lymph nodes to check for spread. Sometimes, they also remove the spleen if the tumor is close or has spread to it. This more extensive surgery aims to ensure all cancerous cells are removed, reducing the chance of recurrence. Postoperative care also varies significantly. After surgery for benign tumors, patients generally need less intensive care. They are monitored for complications like pancreatic fistulas, but recovery tends to be smoother. For malignant tumors, patients often need additional treatments such as chemotherapy or radiation therapy to target any remaining cancer cells. They also require closer follow-up because the risk of the cancer coming back is higher. Long-term outcomes depend heavily on whether the tumor was benign or malignant. Patients with benign tumors usually have a very good prognosis and a low chance of recurrence. In contrast, those with malignant tumors face a higher risk of the cancer returning, which might mean ongoing treatment and monitoring. In summary, knowing whether a tumor is benign or malignant is essential when planning a distal pancreatectomy. It guides the surgical approach, influences post-surgery care, and helps predict the patient's outlook. This information allows healthcare providers to tailor treatment plans specifically to each patient's situation, aiming for the best possible results. Always remember, if you or someone you know is facing this kind of surgery, consulting with a healthcare professional is the best way to get personalized advice and care based on the latest scientific evidence.